Right. Well, welcome everyone. Good morning. Hope everyone's having a good week. Really pleased to welcome so many of you today. We are massively excited about this event. We know that the Armed Forces Covenant has been successful in raising awareness of the challenges faced by veterans and their families as they try to adapt to civilian life. And today we're going to hear from three organisations who've been running really successful programmes with the aim of helping to bring expert and people who are really talented, who've been in the armed forces community, into the health and care workforce through the power of volunteering. So we're going to hear from national charity The Poppy Factory, from Lewisham and Greenwich NHS Trust, and from North Tees and Hartlepool NHS Trust, who are going to be sharing their real life examples with us, which we hope are going to be inspiring for you and give you a really good understanding of how you can support these amazing communities. So you'll also learn about upcoming opportunities to bring the volunteer to career for the Armed Forces programme into your organisation, if that's an option for you and if that's something that you're passionate about. So you'll hear a bit later in the session about that. We've allowed 15 to 20 minutes for Q&A after the presentations, and we'd ask that you use the chat box for your questions, and then I'll round them up as part of the Q&A towards the end. And for now, can we ask that you turn off your cameras and mics if you're not presenting, just to reduce the chance of glitches? That's great, thank you. It's a packed programme, so I'm not going to waste any time in handing over to our first presenter, who's Leanne Gosson from the Poppy Factory. This is a national charity supporting armed forces veterans and their families into employment. And Leanne is also the London Armed Forces Project Manager. So welcome, Leanne. Good to see you.
Good morning, and thanks so much for inviting me to come and showcase what we do here at the Poppy Factory. So yeah, I'm Leanne Gosson, and as Sally shared, I'm the London Armed Forces Project Manager. If you don't know about the London Armed Forces Network, it basically connects military and non-military organisations and charities together that can support the armed forces community. We currently meet quarterly, we share good practice, we provide updates and discuss barriers that clients are facing. And my other role is I'm also an employment consultant for the East of England, and I work directly with veterans to remove barriers and hopefully seek meaningful employment after service. So I've got a very quick whistle-stop tour of what we do here at the Poppy Factory and a little bit of how we think that a volunteer to career type programme would benefit them. Thank you. So the Poppy Factory has been running for over 100 years. It started to provide job opportunities for injured veterans. Not only that, but they also built housing for their families, helping build that community, really recognising the importance of stability to be successful in employment. This is the ethos of and the focus that we still have today. They started making poppies for the Royal British Legion's Poppy Appeal, and this today is what our veterans are still doing, alongside making over 100,000 wreaths last year. And we also organise the Field of Remembrance at Westminster Abbey. And we still have that factory today. Thank you. Alongside that factory, we also have a visitor centre, if you didn't know, where individuals and groups come to learn about the history of the poppy and the factory. You can come and admire some royal wreaths that were designed by His Majesty King Charles and Queen Camilla. And varying organisations, as you can see from the pictures here, are hire our venue or factory as part of community or teamwork event. And I think it's always good to know that the money that you're putting into hiring these events is going essentially straight back into directly impacting our veterans. So what are we doing in terms of what have we done last year, our impact for our veterans? So last year we supported over 1,000 veterans and their family members, and that works through 3 supportive strands. So as you can see, we work all over the UK. We do also work in Northern Ireland, but that is supported remotely. So our first strand is our Veterans Employment Service. And that's where us employment consultants work with them on a one-to-one basis. These veterans can self-refer, or a professional can refer them in. It is great if a professional referral can come in, because it just really helps create that collaborative support, and also ensure that we're not duplicating the support for them or getting the veteran to retell their story over and over again. We have a holistic approach to how we support our veterans. We look at their stability, finances, health and well-being, just to ensure that there's no barriers that are to them being successful in employment. We help develop their CVs, interview prep, job searching skills. Essentially, we're kind of a job coach, and we work really collaboratively with the individual. We're not a recruitment agency. We do help search for jobs alongside the client. We just really want that meaningful employment at the end. Once they've got that, we do then offer a 12-month in-work support service, and that can be, again, dependent on the client. It can be nothing at all, or sometimes we are engaging directly with the client and their employer to ensure that they stay in that employment and everyone is supported. Our second service is our Families Employment Service. It kind of runs very similarly to the Veterans one, but it's only delivered online. Sorry, still on the same slide. Thank you. So it's our Families Employment, and that is for spouses, ex-partners and dependents of over 18. And they work really closely with the Ripple Pond, another charity that supports carers of veterans, helping them build a community and support their mental health also. And our third strand on there is our Navigator service. So these are for clients who maybe are not ready for employment currently, but really want to engage in some meaningful activities. Our kind of gold standard aim with this is that they join the Navigator service for 6 months, where it's in a nutshell, a hand-holding service for them to access support. And then hopefully they will move to one of our employment consultants to then look for a job afterwards. This is a professional referral only route. And as you can see listed on there, we only work in these areas, as because it is a hand-holding service, we need to make sure our navigators are close by to the client to ensure a really good standard of support. One other just important point about the Poppy Factory is we're not a grant-giving organisation. We can help with funding applications towards jobs and things like that. But yeah, we don't have that pot of money. And at the end of the presentation, I'll share all of the referral links should you find any veterans that need support. So let's have a bit of a look at the impact that we've made. Thanks very much. So having this volunteering to career route in mind, as you can see from our employment service, we work with a wide range of ages, predominantly 30 plus currently. And what we find within that age bracket is they are looking for a career change. And this can be for lots of reasons. But one of them might be that they entered the army at a young age. Maybe they had a bit of a troubled upbringing, didn't collect any qualifications beforehand, and they've entered looking for some kind of stability. When they come out, they're looking for a new starting point. These people are used to working from the bottom up in the army, and some, when they come out, are also willing to do the same. Start from the bottom, build their skills, and work through to a career. A different role might be that they've found the civilian equivalent to their military role. So maybe they were in the RLC, the Royal Logistics Corps, and then they come out and they go into being a HGV driver. What we sometimes find then is that after a period of time, maybe something like PTSD has arisen over that time, or maybe they're just finding that in the civilian role, it's just not as, they don't get the same bars or the job satisfaction. So they're kind of looking for that new career change. Thanks very much. So our family service. Our family service is fairly new. It will be coming up to 2 years old this April 2025. And as you can see, a high percentage of the support in there is for the spouses of veterans. And so some of you know, most of you know, sorry, often they travel with their partners during their military time. And during that, maybe they're not working, they're supporting the house, or they're holding down small local jobs. And then lots of things can change once their partner becomes a veteran. It could be maybe that their kids have grown up, they've moved out, and then all of a sudden they've got this more time to work on themselves and look at a career. Maybe they continue to support their partner who is injured or dealing with poor mental health. So they find themselves that they're a carer, they're a parent, and then they start to lose their own sense of identity, and they're looking to find some time for themselves in the search of something new. Under that health and wellbeing section, you can see that 90% improved 2 or more of their goals. And we find that often their goals are to build confidence and independence. Again, something that we think volunteering would really help with. Thank you. And finally, that third strand is our navigator service. I want to focus particularly here on that health and wellbeing data. You can see that 92% improved their use of time. These kinds of clients are really looking to start to get into a routine, finding a purpose, and engaging again. And with that sense of routine, they're then starting to build trust with others again, and really starting to build this sense of hope that they, that they can achieve goals and there is a purpose for them. Thank you. So there are many reasons why we think a volunteer to career programme might be good. These are 6 of them in general. First one is qualifications. Lots of people come out of the military with lots of different qualifications, some that will directly transfer, maybe some that won't. And I think there's a lot of personnel out there that are not sure how their qualifications translate. And to be honest, neither do the employers sometimes don't know. And this volunteering route could get them both a segue to them both understand the transferable qualifications. But not only that, to learn the qualifications that they may need to take a career in that and understand what that looks like better and the commitment towards that. I've already spoken about kind of why the armed forces community might be looking at a new career pathway, but really lots of people enter the military service because they want to deliver a life of service. They want meaningful employment. And for whatever reason, that has come to an end in their military career. So they're looking to continue, where can we deliver that life of service? And the healthcare sector could definitely be one of those. It can make them feel like that they're still serving their country and they're still supporting people. The nuts and bolts is it, you get to try before you buy, don't you? Before you go into that career, you get to really feel what that job feels like. And as we know, volunteers in a lot of different organisations can take some of the strain off of some of the full-time employees that you might have in your organisations. Our armed forces community come out with so many transferable skills that, again, sometimes them themselves or employers don't always see. Teamwork, communication, soft, hard skills. There's so many. And by having this opportunity to go and practice those just really helps increase their confidence. Maybe they will gain new skills, refresh ones they already had. Getting back into that routine and that teamwork just develops that confidence. And overall, it gives them a sense of purpose. Like anybody, but particularly these cohorts of people, they want to succeed. They come with determination, respect, a great work ethic, and really adaptable. And they're just looking for opportunity to develop in this, what is to them, this new and civilian world. Thank you. So hopefully I've highlighted, albeit very briefly, what we do at the Poppy Factory and how the armed forces community could support the different organisations out there. There's many case studies on our website, should you wish to explore that further. But what I'd really like everybody to think about is, what is it that you can provide for them? What opportunities, support, guidance can you put into place to ensure their success? My personal opinion, make the process clear, simple, but also progressive so that they can see their short and long-term goals. Next one, thank you. So as promised, here are the links to our 3 referral pathways. And I've also put the link on there to the London Armed Forces Network. It's our LinkedIn page. Should you wish to connect with that at all, And yeah, I look forward to taking any questions later on. Thank you so much.
Thanks so much, Leanne, for a really, I know it was a whistle-stop tour, but we learned a lot from that. Really inspiring. Thank you ever so much. And hope there'll be some really great questions for you a bit later on. So I'm going to hand straight over to the team from Lewisham and Greenwich NHS Trust. So we've got Margarita Vidiella, who's Head of Charity and Volunteers, Jason Watson, Jason's Business Manager to the Chief Nurse, and Richard Lee, who's Voluntary Services Lead. So over to you, folks.
Thank you, Sally. Yeah, hi, I'm Jason. I'm Business Manager to the Chief Nurse, Chief Medical Officer at Lewisham and Greenwich. I'm just here to talk to you about our Volunteer to Career programme that we've launched at LGT. So Helpforce invited us to join the programme, and we were really thrilled to be a part of it. It kind of fit alongside of the various other work streams we're working on in terms of our veterans, military spouses and reservists. Yeah, next slide, please. One of the things I think we've discovered throughout launching the program, so this slide just contains our vision and our values at the Trust. And although we find as many opportunities as we can to kind of live our values, one of the things that's really jumped out at us throughout this program so far is succeeding together over achieving alone. And Margarita will touch on this a bit more in the presentation, but throughout starting this program and where we've gotten to so far, we've really established a number of new partnerships with other organisations in the armed forces community, and it's been really good to see all of the good work that's going on and how we can benefit from each other's experience. Next slide, please. So one of the things that we've been really focusing on is why we wanted people to choose to volunteer with LGT, and this slide just kind of summarizes some of the key things. So we provide care and services to over 1 million people in our area, and we employ over 7,500 members of staff, which are supported by over 200 volunteers. Over the past few years, we've managed to achieve improvements in our recruitment and retention year on year, as well as being able to be the recipient of a number of national awards last year. And perhaps more importantly, we've successfully launched a Volunteer to Career programme already, which we've had loads of lessons learned from, and we wanted to kind of focus that as a part of this programme on our veterans and military spouses. I'll now be handing over to Richard, who's going to take us through a bit more of our volunteer programmes at LGT.
Thank you, Jason. Yeah, if you'd like to go on to the next slide, please. So volunteering at Lewisham Greenwich NHS Trust. So what do our volunteers do? So they play an integral role in supporting our trust visions and values. So a number of volunteers that can do many different types of things. They're all non-clinical activities. So I assume that, you know, some people might come in and feel to themselves, oh, I've got to do something clinically if I'm going to be working in the NHS. So all our roles are non-clinical. Our candidates are considered from communities that Trust serves, which is Lewisham, Greenwich and Bexley. And as I've already said, they are non-clinical experience. So our volunteers are there to improve the patient experience from the non-clinical side. So they're there to enhance the patient experience, improve their journey while they're here. We very much look after the patient's holistic care. So what do our volunteers do? So as I said, they provide non-clinical support. So our volunteers specialise based on wards. They could be doing anything from manoeuvring patients. It could be supporting during meal times, or are actually looking into training our volunteers how to feed patients. Our volunteers are also trained in how to support patients who are vulnerable, such as those with dementia and delirium. So, you know, there's a real opportunity for volunteers, veterans to really grow, especially if they're maybe looking into going into medicine. And as I said, even though that they won't be getting experience from the clinical side, just being in that sort of environment will improve on confidence, improve on self-esteem. And as we've said in the past, or previously, should I say, that, you know, it'll tell them whether they want to pursue a career in healthcare. For those, as I appreciate, going on to wards sometimes can be quite daunting. So we also have the likes of our meter and greeter roles, which play a really important role, especially our hospitals being quite large. So it's always nice to, you know, and we also have to appreciate that not everyone, you know, you don't want to come into hospital. That doesn't sound very positive when I say it, but what I mean is that, you know, most of the time people visit the hospitals because they're unwell or they're coming to visit someone who's unwell. So having someone there who can guide them where we need to go, have a welcome smiley face really does go away to improve the patient experience and improve their journey while they're with us. So we also support our maternity services as well. So maybe those who are looking to go into maternity or working with children. We've got a lovely wellbeing garden here at ULH or University Hospital Lewisham. So those who are looking into going into gardening, we can provide that. Mealtime support. So we very much, I don't know whether I mentioned this possibly already, if I repeat myself, freeing up staff time to care. So by delivering food, taking patients' orders, it frees up staff to support patients' clinical needs. We also support with things like children activities who have like arts and crafts, musicians who come in. It's very therapeutic to patients, as well as adult and pediatric departments. If you'd like to move on to the next slide, please. So the application and commitment. So there is a process. So it's not a case of applying today, starting tomorrow. There is a process that we need to go through to make sure that everyone is compliant, everyone coming into the hospital is safe, because obviously we have a duty of care for our patients, but we also have a duty of care for our volunteers as well. So it's a minimum of 2 hours per week over a 6-month period. We are looking for key personal qualities such as showing empathy, putting yourself in patients' shoes, feeling what they feel. Listening, obviously our volunteers are our eyes and ears, so they will see things that we don't see. Communication as well, that's both verbal and non-verbal. We look at things like emotional intelligence, observation, as I said already, that they are our eyes and ears on the ward. Reliable, the only way that we're going to be able to offer a really excellent service is by having volunteers who come in, week out. The way that we look at it is that, if we're not able to provide volunteers who are reliable, the likes of wards, other support services are going to lose trust in us, and then there's no need to have a volunteers team. That they're open to learn. So as I said, we also do provide additional training, so supporting during meal times, as I said, like feeding patients, supporting patients suffering dementia and delirium, and obviously those that have got attention to detail as well. So they must comply with policies. So, for example, on our wards, it's all bare below the elbow. So that's the likes of rolling up your sleeves, removing any jewellery, any watches, wearing PPE from time to time. So if you're not aware, PPE stands for personal protective equipment. So that's the likes of your gloves, your aprons, and so on. Confidentiality and attendance. So what we say to our volunteers is what you see in hospital stays in hospital. However, at the same time, if you see something like a patient's going to be putting themselves at risk, so for example, if a patient confides in you that they are suicidal, is obviously to highlight that to a member of the healthcare professional. Dress code, so we do provide our volunteers with a uniform as well as a yellow badge, so they're easily identifiable. Non-clinical activities I've already spoken about, but we also have to be aware of things like boundaries as well, and that's not to give medical advice, even if the volunteer is trained in medicine, and also to embody the trust, visions and values I've already spoken about. So again, there is a process, so they pop in their application. Then what happens is we do a little assessment where we just talk a little bit about what volunteers do, likes of what you can hope to get out of this experience. We then need to take them through some mandatory training as well as checks. So that involves doing the trust, statutory and mandatory training, identity checks, which is a DBS, or criminal record check. We then refer them to occupational, because obviously the well-being of our volunteers is paramount. So we refer them to occupational health for a checkup. And we do ask them to provide at least 2 referees. And then the exciting part when they actually get to start. So we invite them in. There's a couple of forms they need to complete before they start. We give them orientation of the area that they're going to be volunteering in. We go through the activities they're going to be supporting. And then we agree on a start date. So yeah, as I said, it's a really exciting program. There's really a lot for volunteers to get involved in, that just coming into that environment. We appreciate some people maybe not even come into a hospital environment before. So yeah, but that's all my part. So I'm going to hand you over to Margarita now.
Thank you, Richard. So launching the Volunteer to Career program, so we were really delighted to be part of this, as Jason mentioned. We run a successful maternity Volunteer to Career program here at LGT with Helpforce last year, and the results were fantastic. So the way we want to launch this time with the veterans and spouses is build on that success. And one of the key pillars for us to succeed is build relationships with veteran support organizations such as the Popper Factory. So Leanne, I really appreciated enjoyed your presentation. I would love to catch up with you following this in terms of all the pathways. What we want to do is build this for success for all of the veterans and spouses who join us to really succeed, to find meaningful roles, and also to ensure that they gain what they want, whether it's experience, try before you buy, or to continue education in medicine or in anything else that relates to the trust. So we're also building relationships with our local barracks and other organizations. So we build these pillars. The other thing we've done is get buy-in from senior colleagues championing this opportunity. And this is why Jason is involved in this opportunity. He reports to our chief chief nurse, and therefore we have the buy-in from the senior colleagues. They want this to make this happen. And also we have a very strong LGT veteran network. We are accredited, we are signed to the Armed Forces Covenant, and currently we are silver. And what we want to do is reach that gold. What do we need to do to really support our veterans and spouses, not only in the care that they receive at our trust, but also with the opportunities they may have, whether volunteering or career. And also what we're doing is reaching out to current veteran and veteran spouse colleagues. Who do we have at the trust who work and can champion this initiative for us as well? And to tell us, yes, and what you mentioned, Leanne, earlier is about the life of service, and how is it that this has been extrapolated then as part of either volunteering or being part of our trust. What we're doing is also reaching out to trust partners. We treat over 1,000 or 1 million patients every year, and we have over 6,000 members of staff. But we also work with a lot of trust partners who provide services for our trust. So what other roles can we provide, such as portering or anything else that perhaps our trust partners provide? So what we're doing is we're building a targeted comms. We want to be very specific on how we recruit this cohort of volunteers from the veteran and spouses. And we want to recruit around 20 people but we want to exceed that. And also we want to specifically concentrate on recruiting volunteers from the communities that our trust serves in Lewisham, Greenwich and Bexley. And next slide, please. So the pathway that we have built is that after we advertise and we generate these comms in terms of who would want to be part of this through targeted communications, we'll invite and signpost potentially volunteer candidates to come in and speak to us, to speak to our team. What is it that you're interested? Why do you want to volunteer? And what can we do for you? And then after the recruitment process, which Richard mentioned earlier, then we would have a dedicated volunteer induction and also let them know the awareness of the team, who we are and what can we offer. We'd also want to understand why they want to volunteer. Is it because they have an interest in working at a trust, or they want to gain confidence or experience, or they just have a bit of time that they want to spare and they're not exactly sure what to do? The other great thing is that at our trust, we got close links with other volunteering organizations within the communities that we serve. And therefore, if potentially we don't offer what the volunteer may want, we may be able to well signpost to other volunteering opportunities within our community. What we want to do then is identify a really brilliant volunteering role for this candidate. They're giving us their time. They want to gain skills or gain experience, and therefore we'll work with our internal teams as to how we can find these opportunities. And then what we will do is also offer employability support, whether it's internal or whether it's external, signposting through all the fantastic organizations that already support veterans. And then hopefully after they volunteer for about 6 months for a minimum of 2 to 4 hours per week, then we can help them in securing employment, whether it's at a trust or externally, or further education. Next slide, please. So this is one of our success stories I wanted to share with you. This is from our maternity. We had Sue. Sue joined us last year with our Volunteer to Career program, actually the year before last. And Sue had been made redundant from her role. She used to be in administration, local community as well. And she thought, you know what, I think I want to work for a hospital. She joined us as a volunteer, and then she joined the Volunteer to Career pathway at our trust. And within within 3 months, she was recruited. She found an opportunity, and this is why she's so keen to share her story, because she really wanted to know what it was like, and she came in with not real any expectations, and within 3 months she's part, and she's working for us now. She's absolutely fantastic. And next slide, please. So what we're building with Jason and Richard is pathways for us to people to access the Volunteer to Career program. So at the moment, we have really strong links with maternity, ward, guides, admin, and also gardening. We have these pillars as part of our volunteering program that are really strong. And what we want to do is build these roles specifically for veterans and spouses. And it doesn't deduct from the way that we may require further roles, such as porters or anything else. And what we'll do is signpost this opportunity in the community, and to invite them to apply to become a volunteer, or to find out more about how we can make a difference to them, and they can make a difference to us at our trust. Next slide, please. We also, I believe that the slides will be shared afterwards, but we have a staff story that we created last year of the colleagues who successfully obtained employment here at our trust. So we'd love to share this with you. I'm conscious of time. Next slide, please. And then we have a slide with all our key contacts, how to apply. So we'd welcome any questions or queries or follow up with you. But thank you so much for your time. And I believe then later there'll be time for questions. Thank you all.
Thanks, Margarita, and thanks, Richard and Jason as well. Really great presentation, so much information in there. So I imagine people will need to absorb that for a few minutes before the questions start coming in. But thank you so much. Really great. So I'm going to hand over to Paul Wharton now from North Tees and Hartlepool.
Morning.
Morning, Paul.
I'm embarrassed.
Why?
No slides at all. Oh no, I'm embarrassed. That is so well done. Thank you. But I have a couple of questions that Mark kind of primed me with, and I'd just like to talk through what those answers are. My personal interest around helping veterans is my experience with a couple of volunteers who were veterans, who one of them particularly admitted to me that he suffered from post-traumatic stress. We helped, and organically we supported him, and he moved into work, now working for a local mental health trust. And since then, it's always kind of sort of pricked my conscience about, are we helping the veteran community, the armed forces community? Can volunteering be an option for them to move into work? And it certainly can. We also, same as Margarita, delivered a successful volunteer to career program. We were supporting the team support worker recruitment program for our trust. We had a great success with that. So when the opportunity to look at veterans in particular, that was really interesting to me. So that's kind of my motivation, if you like, to move towards that. I'm also quite liking collaboration and working with people. Shared load, better outcomes, bigger outcomes, more opportunities. It always makes sense to me to work with others. So I chatted and spoke to people, my colleagues at other local trusts, South Tees, County Durham, Darlington, and Tees and Esk Wear Valley Mental Health Trust, about see if we could work together, put a presentation and talk to Helpforce, Mark and the guys, to see whether we could deliver a Tees Valley approach. And I'll talk a little bit about that in a second. But really, the pathways we've got available are very similar to Margarita's. We've got clinical volunteers, or not necessarily undertaking clinical tasks, but within a clinical setting. Welcomers, volunteer drivers, porters, domestics, caterers, therapeutic care, neonatal support, other activities, gardening, pet therapy. So we try to cover as many opportunities as we possibly can within our 4 trusts. So the way we work is we now have, we just recently started this, we have all our 4 trusts' websites linked to, or have pages within it explaining that we are developing a volunteer career for the armed forces community. If anybody's interested, there is a link in there which takes you to County Durham and Darlington's website and their contact details, because we describe how we work as a hub and spoke model. The hub is the County Durham and Darlington Trust, and ourselves, South Tees, Eskom Weir Valley are the spokes. So if anybody contacts our website, wants to be get involved, they will be taken through to County Durham and Darlington, where they'll meet the lovely Claire. She will have a chat with them. She'll essentially triage them, find out what they want, where their interests lie, where they live, because they may be more interested in working here or South Tees or County Durham Darlington. So we'll get the best fit for them. Across all sites, we're probably offering pretty much the same, but if it's somebody who, let's say, well, therapeutic care, the experts are South Tees, the chances are if we can get there, they would do that. But if they couldn't, we would look to do something similar with each of the other trusts. Then Claire would instigate the application process. So we have an application that we would send out. This is then forwarded to each of the three outlying trusts, the three sport trusts, if it's one of those that are appropriate. And we would then undergo the same recruitment process as anybody else within the NHS trust and bringing a volunteer in. We undergo that process to make sure we've got the right people, square pegs, square holes. DBS check if required, references, OC health, that kind of thing. Then we get them started. We continually working with our, I suppose, clinical staff in the broader sense to make sure that we are offering not just the volunteer aspect, but access to other learning opportunities that may be available. We have a commitment that we will help and support during applications for employment. The Tees Eskom Weir Mental Health Trust also deliver some employability sessions. So I'm hoping that we will get access to those and be able to sort of filter and funnel our volunteers into those so they get a little bit more formal support in that aspect. That's kind of how it's working at the moment. We've only recently started getting some referrals, and I'm picking up on an email, Mark, that you sent me about how's it going. I need to pick up on that, to be honest. I've been out of the loop for a week or so. We'll work with that one. I think one of the largest, even now, I can probably say the largest learning curve for me and us has been about networking. One of the things we're finding is that there is so much going on out there. I'm really quite surprised that there is so much going on around the armed forces community. I've just picked up another email this morning that there is another quite a large meeting that the mental health charity trust have picked up, and that we're going to sort of organise and make sure that we're going and introducing ourselves to the armed forces community and promoting what we're doing. Similar to what Leanne picked up on, certainly volunteers will pick up on independence, confidence building, and interesting that, Leanne, that you mentioned about the trust aspect to it. I guess that's kind of what we're trying to overcome, and how we're trying to develop the network is to overcome that trust issue and try and build our relationships with the organisations who already have that trust with their veterans. So that's really interesting, huge learning curve. But in terms of how we can help people into work, I know that South Tees delivered a successful volunteer to career project. County Durham Darlington did, we did, and we are supporting with Tees Eskom Weir Valley to sort of bring in and share that growth and that sort of expertise, really. So I feel as though once we've overcome the development in terms of relationships and collaboration, I think we'll have a really successful, and any armed forces community resettling into the Tees Valley, and they're looking, I think Yeah, I was going to say, if they're looking to come and work within the health service, they need to sort of contact us as an option. But in many respects, you don't have to be looking to come to work within the health service. You don't have to be looking at clinicians. There are so many other opportunities around a trust. You know, we talk around portering, driving, catering, domestics, that kind of roles. If those are appropriate, they're all in hospitals. Administration is another area that I haven't mentioned that we've got opportunities in there. So opportunities, if you're struggling with a little bit of confidence, self-esteem, look at this volunteer to career. If you're a veteran, certainly look at this volunteer to career, because there is a huge opportunity for you. Have I covered everything, Mark? I hope so.
That's amazing. Thanks, Paul. It's really, really helpful to hear about your progress so far and the importance of creating a network and an infrastructure before you get things off the ground. It's really helpful for people to hear that. So thank you for sharing that. I know it's not the finished article, but really great progress so far. And I hope that people will feel as if it's doable by hearing your experiences so far. So thank you for that. Right, I'm going to hand over to my colleague Mark now, who's going to tell us a bit more about how you can get involved. Hi, Mark.
Hi, Sally. I think Sam's just bringing up the slides. Good morning, all. Lovely to be here. Really excited to be here to talk to you about the exciting new Help Force Volunteer to Career Armed Forces Community Programme, which we've heard a couple of examples of from Lewisham and Greenwich. But I'm mindful that we've actually got quite a few new people that may not know about Help Force. I'm just going to quickly just provide an overview of Help Force and who we are. So we're a charity, small team, 20 of us across the UK. Our mission is quite simply to accelerate the growth and impact of volunteering in health and care. And we do that through co-design, working with healthcare leaders in designing volunteering services to help meet the pressures and reduce pressures within the healthcare system. We have a fantastic team here in Help Force, the Insight and Impact team, that can build evaluation frameworks to measure the impact of those services, which of course will help in terms of making the case and sustaining and securing further funding for the programme. And we do it through collaboration. We work at a system level with ICSs, ICBs, organisational levels, and we've had some fantastic healthcare partners across the NHS, across adult social care, across hospices, and growing day by day. Next slide, please. One of the most successful programs we have is the Volunteers Career Programme. We've heard a little bit about that today from our fantastic speakers. But in short, what is it? It's a workforce initiative delivered through the medium of volunteering. It starts at a discussion at a senior level in identifying what are the workforce needs, short, medium, long term, simultaneously discussing with senior clinical leads where the pressures are on the healthcare system. And that can inform what type of volunteering role we then run through the Volunteering to Career programme. And with a well-developed career pathway identified against the workforce needs, the volunteer gets that experience, comes in, undertakes that volunteering role, gains an experience, the culture, an understanding of the culture of the environment through the medium of volunteering in a clinical or non-clinical setting, whilst gaining access to the career pathway. But all of that is there to help someone make their mind up. Is pursuing a career or an employment within health and care for me? So it's very much a stepping stone approach. We've heard the terminology try before you buy discussed before today at the previous presentations. And on average, it takes, from our experience, around 3 to 4 months. We've supported about 55 healthcare organisations delivering VTC. So it's about 3 to 4 months, somebody participating in the programme that wasn't sure, but I am now, to make their minds up. But also for some that have come in on the programme and haven't experienced the culture. Hospice settings can be an incredibly challenging culture, but decided it's not for them. So it has worked either way. Next slide, please. This is really just to demonstrate that we've worked with and are working with a wide range of organisations from the sector, ambulance trusts, acute primary system ICSs, as well as hospices and adult social care. And we're continuing to work with more and more organisations with the Volunteering to Career programme, and looking at how we can do it at super scale. Moving on, conscious of time. So what? So the so what question. So what have we achieved? So to date, of all of the participating volunteers that have moved into, gone through the programme, have secured either employment or decided to embark on clinical training. If I take Shrewsbury and Telford Maternity Hospitals, with the senior sponsorship from the chief nurse and director of public participation, they wanted to develop a homegrown workforce of midwives, having engaged with the local community and run a midwifery, a bit like Lewisham and Greenwich, a midwifery focused VTC program. 12 months on, 3 cohorts later, they've now got 30 VTC volunteers signed up to do a 3-year midwifery degree. The chief nurse is delighted, as there is now a future workforce of midwives coming through. Shrewsbury, all from the local communities. Big RAF community in Shrewsbury, Telford, and a number of those that have signed up to do the midwifery degree are actually spouses, partners of veterans also. So on the back of this success, moving on please, we then thought, well, could Volunteer to Career benefit other groups within the community? And we started to think about the armed forces community. So we engaged and pulled together a steering group, if you like, of veteran aware leads, NHS veteran aware leads, and representation from the service. And we asked the question, is there a need for this type of service? Is there a need for a volunteering service with a career bolted on career pathway? And I think the general consensus that we got from the group was yes. Leanne's talked around some of the challenges that a lot of veterans and members of the armed forces community face in terms of lack of confidence, mental health, anxiety. We haven't talked about it, but we've also been told that some service leavers struggle, and need some support with literacy and numeracy, and that can be a barrier to employment also. But thinking about the Op Courage programme and thinking about how we know there are benefits of employment that we've learned from the delivery of the Interpatrial Support Programme, could, by participating in the Volunteer to Career Programme, be considered as part of the Healthcare Recovery Plan. So there are many reasons. And through further research, less than half, 44.5% of service leavers feel they found the right job for them in the longer term. Many haven't considered a career in health and care. And thinking about how many times a family in service can move, and partners and spouses, is there an opportunity for partners and spouses to explore careers within health and care, recognizing many of those roles will enable lifelong careers, life of service, and our transferable skills, thinking about the number of hospitals. And of course, the impact, the challenges the NHS face with 100,000 vacancies and 160,000 vacancies in adult social care. Moving on. So cut a long story short, having gathered all that information, we've been successful in securing some funding from the very generous Swire Charitable Foundation Trust, and now running this 18-month programme. We started in October and we're running it through to March 26, but really through the creation of the co-design evaluation framework that we've built with members from the armed forces community's input, we want to understand the best way to recruit members of the army. We don't know who we're going to be. Is it going to be veterans? Is it going to be spouses? Is it going to be partners? Is it going to be children? Who is it that's going to be most interested in this program? So very much a learning exercise that we're going on here with this program. But we want to understand what adaptations we need to make to the VTC model, thinking about all the challenges, that flexible stepping stone, on our ability to support with the building of confidence and self-belief, trust, and allocating existing veteran volunteers to a VTC volunteer. So we've got that peer-to-peer and that support. So all of this is what's going to be evaluated throughout the programme. Moving on. So we ran an expression of interest, and we were delighted with a number of organisations that stepped forward. But cut a long story short, we're working with 11 organisations, and we've heard from 2 of those today. But there are many others that have now designed the career pathways based on workforce needs, and are now at the point of where they've gone live, and now engaging locally with the armed forces community to promote those services on offer. And we've actually produced a national flyer that provides all the details of the organisations, what career pathways on offer, and how to apply. And for those on the call that be somewhat inspired what you've heard today, we're very happy to share that with you for distribution to encourage referrals. Moving on. So last slide from me. So in terms of the programme, what we're looking to achieve, ideally we want to attract 400 members from the armed forces community. 66% of those, ideally, we'd like to have embarked by participating on careers or in employment. Hopefully 95% will increase their confidence and ambition to pursue a career. And ideally 7 of those delivery partners will sustain and scale beyond the funding envelope. And in terms of what are we going to do then, with the support of the Armed Forces Steering Group that we're working with, ideally what we'd like to do is to take the macro report, so the evaluation of the findings of this programme, to the Office for Veteran Affairs and sit down and talk to them and encourage them to think about how volunteering, just the same way Darcy has regarding how to support the NHS going forward, and suggesting that volunteers in the community 6 million could help. And we want to do the same with the Office of Veteran Affairs and say, look, should we be considering volunteering with a bolted on career pathway as a transitioning service, and consider that as business as usual going forward. So I'm going to stop there, hand back to Sally, because we need to do some Q&A. And thank you.
Thanks, Mark. Yeah, whistle stop tour, lots of information in there. And we, just to reassure everybody, we will be sharing the slides from these presentations with you. I think somebody's come off mute. Okay, so we do have a few questions in the chat box. We may not get through all of them. Just a very quick one from Mia. Is the funding for the SWIRES programme available to health boards in Wales? Mark? You're on mute, Mark.
I should know by now, chatting to myself. So the funding we've secured from the Swire Charitable Foundation covers the costs for the programme management and the evaluation. We haven't been able to allocate any funding directly to the delivery partners, and it's just fabulous that we've got the number of delivery partners that we have. So the commitment needed from delivery partners is really about providing the resource to be able to run the programme and work with Helpforce. And that is existing resource. A lot of the delivery partners we've heard presentation from today is existing resource, but they're just working across the organisation with other members of staff to be able to run the programme.
And that's open to boards in Wales as well, Mark, just to confirm.
Yes, it is.
Yeah,
forgive me.
Thank
Yes,
you.
it is.
A couple of people asking about the national flyer, so we'll make that available with the resources from today's session.
We'll send that out, yeah.
Yeah, thanks, Mark. Karen has asked how many of your veteran armed forces community volunteers go on to work in the NHS. Karen, I'm hoping that was answered by Mark's slide with the stats. Is there anything further you'd like to ask about that?
I was thinking of existing schemes that are in place, whether any colleagues that are on the call that are already doing this have got any kind of outcomes they can share, really. I mean, that's not to be kind of like there's a, to be judgmental about it either way. It's more about to sort of understand the challenges to then supporting people on to work in the NHS, because it may be quite low numbers, but actually for those individuals, it'll be a fantastic outcome. So I'm just interested from colleagues on the call about any successes they've had currently.
Okay, thank you, Karen. Mark, I don't know if you can kind of give a bit of a flavour of that. I know we can't go into detail with the time we've got left, but
well, I mentioned earlier, we've worked with about 55 healthcare organisations over the last 2.5 years, and what I can say is we have already attracted a number of veterans. We have already attracted a number of people from the armed forces community that have participated in the programme and have been successful in either moving on into employment or embarking on careers, and having done some surveys with regards to some of those volunteers and asked the question, what's worked for you about this programme? It goes back to what Leanne was referring to, is that try before you buy, that stepping stone approach. It's just over that 3 to 4 months, it's given people the opportunity to experience the culture, the new language, which can all be very daunting, for service leavers, rather than jumping straight from service into Civvy Street. I think we might have some case studies we might be able to share as well. I think we have regarding veterans that we've worked with.
Yeah, Karen, we will have a look for that and see if there's something along those lines we can share with the resources from today. Hope that's all right. Thank you for your question. And same thing to Lindsay, you've asked about where can we see the volunteer to career story. Again, we'll source some case studies and share those with everybody. Sarah Jane has asked roughly how long is the recruitment process to start date? And do you address this at the time of advertising or during their initial chat for the role? Did anybody like Margarita? Hi.
Yes, so at Lewisham and Greenwich NHS Trust, it's all mentioned at during the application, but it can take between 4 to 6 weeks between all the checks. And we do support our colleagues, our volunteer candidates during their application.
Great, thanks, Margarita. And then a question from my colleague V. What challenges are veterans and spouses experiencing when trying to look for jobs? Advice that NHS organisations can learn how to better support them. So Leanne, I'm going to go straight to you on that one.
Thank you. Yeah, I'm going to come at this probably from two angles, I think. I think one is the looking for the jobs itself or the opportunities. I think there are so many platforms that people are searching on to try and find these locations where these opportunities are. Try and make that where you're putting that really clear to find. Also, we find that a lot of applications are out of date and that placements have been fitted, but they've not taken off of the system. So that can be really frustrating when they put the time and effort, particularly to apply, and they find out it's not active anymore. So just keeping up to date on that. And then just making sure that also the application is as simple as it can be. I know that NHS has got a lot of checks to get through, and rightly so, but trying to make that transition as simple and as easy, or with support, is my first one. And then within a role itself, I think, Margarita, Richard, and everyone's kind of touched on bits, but overall, I would say it really does depend on the individual. And as Margarita was explaining, one of the second steps is to explore that individual, talking about, going direct to them, talking about what they're coming to it for, what their background is, but also, don't be afraid to ask them about the support they've already got in place, because veterans don't want to retell their story. Some of them do, some of them don't. So get in contact with others and be like, right, as long as you've got permission from that veteran, you can come to an organisation like ourselves and get their story from us, to having to save them from having to have that conversation. And as Paul said, take the time to understand them. I think a lot of employers fear that phrase PTSD, CPTSD, and that they haven't got applicational skills, or that that's going to cause employers issues in that situation. And it really doesn't. It's just having those conversations, really understanding that individual, because they have so much other things to give. I think my other part would be around be really clear on their expectations in the role that they're going into. And that can be really daft. Richard, you were saying things like dress code. That stuff gives them fear of turning up. They're so used to suiting and booting, and they turn up in their gear, and then they're like, oh, everyone's wearing jeans. And even that can even put them off. So having real clear expectations of kind of what that role is going to look like. I think we're talking about kind of walking around the site, having a really good understanding. I think that would be really helpful. For some, not all, maybe having some kind of buddy system, so they've got somebody they can go to directly if there is any questions or issues. And I would really promote kind of regular check-ins, particularly to celebrate their successes. In the military, in whatever role, there's a lot of successes very quickly, and that's very visible, very practical, very physical. And sometimes in these civilian roles, that's not as obvious. So planning in some opportunities to celebrate what they've done and the impact that they are having will help keep them in, because they're kind of seeing that kind of value. Training really helps with early access. Be really clear on kind of what you want. They feel that they're skilled before they go in. And the last one is an understanding of progress. But again, going back to the individuals, some are going to come in and just want to give the volunteering a go for a while, particularly our navigator style clients. They might be volunteering for a bit longer. However, those that are a bit more serious, or maybe in a mental capacity to push, start having conversations about what could happen from this volunteering opportunity. What are the pathways? So they've got those kind of short and long-term goals to work towards, and what does that look like? Finally, I think, Paul, you were talking about it, There are Armed Forces Champions training out there. Within the NHS, you can create Armed Forces Champions through those training. So that, again, that could be that kind of buddy connection system, and ensuring your staff learn more about the Armed Forces community and what they come with. And I'd be daft if I didn't promote my London Armed Forces network, if I'm honest. You know, this is what this is for. Turn up to it. We've got civilian, military and non-military organisations all here with the same aspect of trying to help these people into some kind of, so come and ask the questions, because if I haven't got them, we've got, I mean, it's closely linked with Dr. Phil Moore, who's one of the chairmen of the London Armed Forces Network. There are so many organisations that if we haven't got, someone's going to be there to answer your questions. So I'm going to plug in April 16th. It's a hybrid meeting. If you want to join in, please do click on that London Armed Forces Network LinkedIn. Happy to share my details. April 16th, it's at the Union Jack Club, 1 till 4 o'clock, but you can join it face to face. If you do, you need to let us know, because we need to make sure we've got big enough room, or come and join it online. Sorry, that was a very long answer, wasn't it? But
fantastic. Thank you, Leanne. Loads of really helpful information in there, and an invite as well. So what more could you want? We're going to have to wrap up now, but I just want to draw your attention to the chat box. Please do go through it, because there's been some amazing sharing in there, particularly Irene from Loxley's. Thank you, Irene, for sharing those links to training and jobs and so on. I really appreciate that. Also, another network, Sisters in Service, being promoted. Encourage you to have a look at that as well. If there's any comments or answers you'd like to add to those in the chat box, please do carry on the conversation. And of course, if you are interested in finding out more about the Volunteer to Career programme run with the Swires funding, please contact my colleague Mark Burrett, whose email address is on the screen and will be in the slides when you receive them. So thank you all for coming. Sorry we've run over slightly, but I hope you feel it's been worthwhile. Really great to see you, and have a good day, everyone.